And let's bring in our very good friend, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Good morning, Dr. Joe. How are you today?
Doing good, Ray. Thanks a lot. How are you doing?
Excellent. How can we not with the weather we've had the last couple of days, man? It's been great.
Yep. Ray, I wanted to talk today, though, about something that, again, usually we talk about here with your audience being so astute about keeping up with things, and something that's a little complicated in sports and been percolating in the last week or so. And I hear people talking about it on talk shows. I read some social media things. I've read on it myself a little bit more and talked to several people in town, and that is the issue of the prolonged concussion symptoms as it relates perhaps to the first baseman for the Yankees, Anthony Rizzo. Are you somewhat familiar with what he's been going through?
Yeah, he had a concussion with a run-in at first base like a month or so ago, and he's had this condition now ever since then, and it's lingered for a long time.
It sure has lingered, and so a lot of people really question, is that really the case? Is it something that he's coming up with? Is it something the Yankees have developed or something like that? That's really frustrating to me because people without any knowledge saying anything about it that they'd like to say. But it is definitely a real condition and a very frustrating condition. And the way it seems to present most of the time, Ray, is it will have an original concussion that's moderate to mild concussion. People end up missing time. Perhaps he missed, I think, 4 days and had a full concussion evaluation and cleared the concussion protocol test and returned to play. But his symptoms began to return, and it's a little hard to know exactly when symptoms return. But, again, I didn't see Anthony Rizzo, so I can't comment about that. But I can comment that down at the Sports Medicine Center at Akron Children's, this is something, it's a phenomenon we really do see, and it's very, very difficult. You've got to understand for athletes especially, for their coaches who don't know what to expect from these kids if they do play them, for the medical people who had cleared them and then see them developing symptoms again. And so what do we do with these young athletes? The two people that see concussions most in my office is our sports psychologist, Dr. Allison Weldon, and my nurse practitioner, Tammy Murray. Tammy puts together our Return to Learn programs for kids, and she says at least once or twice a month, and Allison as well, every other month or once a month. So this happens in our pediatric clinic a fair bit, too. So the story is, Ray, for everybody who may not know it, is then later on, perhaps a week, a month, 2 months even, after having a concussion, young people will begin to experience what is, I think, very well described in one phrase, is brain fog. And with this brain fog, they get visual symptoms, where they may have difficulty with their vision. They have dizziness or vestibular middle ear issues. We call it vertigo. They'll have some mild dizziness when they're up and around. They'll have headache. They'll have difficulty concentrating. Many people describe it as, oh my gosh, it feels like for some of these pro athletes like a hangover, but they didn't have anything to drink at all, alcohol-wise, but they feel kind of hungover. They can't process quickly. They have cognitive function, and with all that, of course, they have anxiety, sometimes extreme anxiety, where our sports psychologists have to get involved pretty heavily, pretty acutely to try to deal with the anxiety issues these athletes have. But if you can think about in any sport, but particularly let's just take the sport of baseball, if you're saying that you're having visual symptoms, some dizziness and inability to concentrate up against some of the very best pitchers and athletes that there are in the game, would that make it very, very difficult to be able to be successful in a game like baseball? So what ends up happening, I think in some of our other sports like football or other sports, these may go under the radar for a while, and people are just kind of afraid to tell people about their symptoms. Sometimes they tell us that it's 3 to 5 to 7 days before they say anything. So, the question that we talked about last night was how long do these last?
Yeah.
And I looked up some things on how long these last night, and they can last weeks, months, even a year, years or more. And so very, very difficult to deal with. One of the articles that I looked at last night described it. I thought it was a good description. The brain continues to use inefficient pathways, and the symptoms may persist for several months. So this is very difficult when it comes to any activities of daily living, but particularly when you're trying to get into higher level sports activity with the type of symptoms that these athletes have. And so certainly we get them into vestibular therapy, the dizziness therapy, the concussion physical therapy, where we're working on cervical spine issues. We try to treat the headache and the visual symptoms, but this brain fog may last for quite some time, and this condition known as prolonged concussion symptoms is something that really causes a lot of anxiety in the young athletes that encounter it.
And Joe, I imagined the rest works in a couple of different ways. One, for example, in Rizzo's case, he gets to rest the brain from the day-to-day rigors of being a Major League Baseball player, concentration, anxiety, all that stuff. But also it's giving that brain a chance to realign itself and get healthy.
That's right. Realign itself is very well said, Ray. And there are so many specialists on our medical team, but particularly our concussion team. There are neuropsychologists that actually work on that cognitive pathways of the brain to try to get them working normally again. But under a sports schedule where a game day to day or a practice and a game every week in football, that just doesn't fit with it. And many of these people need to be taken out, and I know it's frustrating for some of their fans and other things on social media, but it is a very real condition. We see it even in the pediatric population down at our clinic, and it's something that we have to continue to work on and do a better job of learning how to deal with and treat it appropriately.
Great stuff, Joe. Thank you so much for the education. And you're right. We've seen this from time to time in all sorts of athletes and all ages, and kind of gave us a little clearer view of the fogginess from those concussions. Thanks, Joe.